Good morning, everybody. We are so glad to be here with you today. We're going to do brief introductions and then we're going to dive right in. We have a lot to cover today. I am Sheraden Nicholau. I'm the regional manager for the California State Council on Developmental Disabilities. I'll talk a little bit about who the State Council is and what we do for those of you where maybe we haven't connected before. And prior to my time with the State Council, I've been heavily involved in IDD services and advocacy and policy work for all of my career, most of it in nonprofit and grassroots, and then now on the government side. And over to Dr. Lynn.
Hi, good morning. Just want to make sure, yeah, it's working. It's such an honor to be here this morning. So I'm Ingrid Lynn. I worked in the regional center system for 18 years, first at San Diego Regional Center, and then for 16 years at Golden Gate Regional Center, where I was the clinical and medical director for 11 years. And then I transitioned to Stanford to do a fellowship in developmental behavioral pediatrics in 2022. And the reason I did that was mainly to help bridge the community academic gap, because I was finding that there were model programs being developed in academic centers that wasn't trickling down into the community. So I started my fellowship in 2022, but I still remain a physician consultant for Golden Gate Regional Center. And for our time today, Sheraden and I will share each of our respective agencies to start. And I'll talk about the history of Lanterman Act and the advocacy roles that brought this system about. And we'll give examples of services and your rights under the Lanterman Act, and also give practical tips and tools to help advocate for services, and then finish with additional resources and examples that you can take home with you.
Great, thanks, Ingrid. So the California State Council. There's a state council in every state and U.S. territory. I'll talk a little bit about the funding models for state councils, but anywhere you might be from, if you're visiting from outside of California, we can connect you with your local state council. And essentially, we focus on civil rights for people with intellectual and developmental disabilities. And here in California, we're both in federal and in state law. And you can see a little bit about our vision. We are independent, so federally funded, but independent as a state agency, which is really helpful because it means we can get involved in just about anything under the sun. And you can see that our focus is to advocate and to promote and to implement practices and policies that are really impacting Californians with intellectual and developmental disabilities in areas of inclusion, access, equity, productivity, self-determination. And I'll talk a little bit about what that looks like, boots on the ground here, and the types of activities that we engage in. And so the State Council here in California has been around for about 55 years. And federally, it's the Developmental Disabilities Assistance and Bill of Rights Act that is our authority. And then we are also in state legislation in California's Lanterman Act services. And a lot of the work that we do falls into three buckets. The first being advocacy, and that can include direct technical assistance for people with IDD, their families, the professionals that serve them, and systems that serve them. So really, we take calls from anybody from your state senator to somebody in high school with an IDD that wants to know more information about how policy practices or legislation impact people with IDD, including Down syndrome. The other bucket is capacity building. So we do that through grants. We have grant cycles. We have sponsorships for year-round opportunities and activities that are promoting inclusion and access for people with IDD and their families. And we also serve on a lot of coalitions and committees and working groups of all kinds, from grassroots to governmental funded, to be able to advance promising practices and make sure that the right things are happening in all industries, in all systems that impact people with IDD. And the last bucket of work has to do with systems change. So that's actual policy and legislation. We have a very active public policy department. If you have any policy, statewide or Fed policy that you're passionate about, I'd love to talk with you. We have a place on our website where you can give your ideas for bills that should impact here in California. And then we do a report every year, and then we work with community members to work on some of that legislation and policy. So we also work on local policy and practice as well for systems or organizations or corporations to make sure that folks' rights and opportunities are intact and advanced in this work. And we'll talk a little bit in this next slide here. Here, in most state councils across the nation, state council is a very small group that might be housed in a state capitol, and they do their grant programming and sponsorship work and are looking at promising practices and giving some support to community members. But because of the diversity and the size of California, we also have 12 regional offices up and down the state. So my team and I, for example, can not just work on statewide projects, initiatives, and policy work, but can work directly with advocates and leaders like you all here today to implement practices and to see how things are working in real time, boots on the ground in the systems that are impacting your lives and your family members' lives and the lives of people that you work with. Working to improve systems, but also making sure that people understand their power. One of my favorite things to do is to work with Californians with IDD and their family to grow and build leadership and advocacy powerhouses in those communities so that they can make the changes that they want to see. And I love to do that in my previous roles, and then to be able to do that in a governmental role is so powerful to make sure that change is driven of and for and by the community. Over to you, Ingrid.
So I'm currently a fellow in the Division of Developmental Behavioral Pediatrics at Stanford, which became a board-certified specialty in 2002 and has really greatly expanded since then. As you can see from our vision, mission, and values, we firmly believe in inclusion and thriving in the communities in holistic ways. I recently heard a beautiful analogy by Dr. Lawrence Fung, director of Stanford's Neurodiversity Project. When a flower is not thriving, we don't think about changing the flower, we think about changing the environment. Going on to the history of regional centers are set up under the Lanterman Act, which became law in 1969. Before then, over 13,000 individuals were incarcerated in state hospitals, with thousands more on the wait list. Parents of newborns were told, and these are quotes from mothers, "Don't bring your child home. Tell your friends that your child died." And in reality, the infants were sent to state hospitals. There was an expose in the newspaper Orange County Register in the 60s by a reporter and a group of parents. And this is a quote from one of the parents. "I saw a patient in Fairview Developmental Center, who has been in seclusion for 2 years in a tiny cell that I wouldn't keep a mongrel dog in. There was no toilet there, no bed, and he was stark naked on the cement floor without even a blanket. The only thing in the cell was a bedpan." This was in the 60s, at the height of the civil rights movement. It was a disgrace and embarrassment to California elected officials. And through the advocacy of people like you and self-advocates, the Lanterman system and Lanterman Act was passed in 1969. California is the only state in the US that has legislation that gives entitlement services to people with intellectual and developmental disabilities, not just the basic minimum. It's an entitlement program. And we'll talk about some of these services in future slides. And just to emphasize that the signing and really the whole system came about because of families like you and self-advocates. And it defines the rights of individuals, of people with intellectual developmental disabilities, and the state's obligation to provide those services. And continued advocacy is critical to upholding the Lanterman Act. We know the system's not perfect, and there's a lot to improve on. And it was a vision that was set up in the 60s. And I think through all of our collective efforts and through continued advocacy, that's how we can improve and protect the system going into the future. These are important photos to remind us how the regional center system and the disability rights movement came about. It's through communities and people coming together with self-advocates, through sit-ins and demonstrations to protect and uphold the system. So we need to stay vigilant and active and engaged. Thank you, Sheraden.
Great. So here's what we're going to do at this point. We're going to give some high-level overview about the Lanterman Act and about the rights involved with this act. Then we're going to talk a little bit about, well, what happens when you're not getting or your family member isn't getting their needs met? We're going to talk about dispute resolution and troubleshooting and some tools and tips. And then we'll talk about some general advocacy. So here's broadly, so I highly recommend, and we have the link, Jessamy and the team are going to make sure that you get this deck. If you've not taken a look at the Lanterman Act online, please do, because that is, right, that is our Civil Rights Act, right? That is what is unique, and as you heard from Ingrid, doesn't take place in any other state, and it doesn't just exist ongoing. We need to actively maintain and advance it. Otherwise, absolutely, the Lanterman Act and other acts like it are at risk of being dissolved and removed. So these are just some of the highlighted areas of the rights that the Lanterman Act put into place that was not there before for Californians with intellectual and developmental disabilities. And I want to emphasize just a few items here, which is focusing on the most integrated and least restrictive environment. So the concept of that people with IDD, including Down syndrome, their community deserves them in it and deserves their leadership and their passion and their brilliance, right? And so we need to ensure that the supports and the services that we're offering Californians with IDD and their families are in the least restrictive and most integrated service environments for them. And that looks different for every person. That natural community settings should always be, to the greatest extent possible, the primary place where people access supports and services, and that people have choices. My life choices are different from your life choices, different than Ingrid's life choices, and we want to uphold that for our community members, families, and friends as well. And then to be able to, having informed decision-making ability, emphasis on the word informed, and that looks different for different people. So however somebody's communication needs are, their learning needs, whatever it takes, being able to build supports in place and systems in place so that people can understand and make choices to the best of their ability. And sometimes that means it takes more time, right, to get things done. And that's the right thing to do. So very high level, because we could spend hours just talking about the structure of regional center systems, but I have my cards, my office cards over there, and Ingrid and I are available and have our contact information on this deck. We'd love to hear from you. So we're gonna move fast and go high level, but trust me, we are here for you and can give you much more information on anything that we're discussing or beyond what we're discussing today. But in a nutshell, if you're thinking, okay, paint a picture, what does this look like, this system here in California look like? DDS, the Department of Developmental Services, that is the state agency that was developed by the Lanterman Act. They're in charge of IDD systems. Now, I want to be clear that this process, and you'll get these decks, so it's up to you if you want to take pictures, but you don't have to. You're going to get the full slide, all of the slides. Important to understand that that department didn't exist before the Lanterman Act, and the whole purpose is to do that work like you saw here. That's the whole purpose, right? Set up a system and monitor it so the Lanterman Act is happening for all people. So DDS doesn't do the work directly. Some states do. Some states have a department on developmental services or on IDD or intellectual disabilities, and they do the work either with government employees or government contractors. But our system is such where you have 21 individual regional centers, by the way, that are nonprofit agencies. They're not governmental agencies, even though some people describe them a little bit like quasi, right? Quasi-governmental agencies in terms of functioning. So DDS, they're the ones that have to ensure that the Lanterman Act exists and is upheld as stated. They have performance contracts with all of the 21 regional centers and provide directives in terms of how to interpret the laws in statute to a certain degree. The 21 independent nonprofit regional centers governed by a board of directors. We're going to talk a little bit about the importance of you knowing who your board of directors is. If you or a family member have somebody associated with the regional center, making sure you know who those people are. They're responsible for determining eligibility per the law, responsible for the coordination of services, and for the individualized program plan with you, and we'll talk a little bit more about that. Now, in terms of from regional centers to service providers, so we just talked about DDS and regional centers. Now, what about service providers? Well, service providers, they don't work for the regional center, right? Those are independent contracts. They may be for-profit or nonprofit. In traditional regional center services, they are vendored, meaning they go through kind of a vendored process. By the way, there's some changes in the system, and you're going to see more standardized approach to vendorization of service providers in the next year. And these services are provided to folks through their IPP, and the regional center and the service corridor specifically is then saying, okay, I'm going to create a purchase of service, a POS, to send it out to this organization who can provide service X per your IPP. And then the service providers are responsible for delivering the services, for documenting those services, and for sending reports back, ideally to the person and their family, and to the regional center to monitor the progress and to make sure that the service is being delivered the way that the person needs. How many folks here have heard about self-determination, the self-determination program? All right. How many folks, either you yourself or your loved one, is in self-determination? Love it, love it. So then we'll go really fast through this, but I would love to hear, here's some of the core differences here. And essentially, if I had a 10-second elevator ride with somebody, I would say self-determination is a way to use your regional center funding in a way that gives you more flexibility, how to design those services for you and or for your loved one. You can see that there's other roles involved, including a FMS, a financial management service agency. So instead of the regional center cutting the check for service providers, it's through an FMS who's a vendor provider. But otherwise, your services might be vendored or not. So there's that extra flexibility. Now, there's still some restrictions. You can't buy anything under the sun. You still need to be able to go through whether it's traditional services or self-determination. Centers for Medicare and Medicaid Services has a list of kind of what would be approved types of services because the Fed doesn't want states spending federal dollars on services that are restrictive or that are institutional in nature. And then home and community-based settings applies as well in terms of the compliance to the final rule. Again, we could go into that, but we have to move along. But I'd love to hear, Deborah and I have known each other for quite some time. If you were to give what are two amazing strengths and two brief challenges in just a 20-second elevator ride for SDP?
Strengths are my daughter is doing exactly what she wants to do that's in her IEP that was not available in any type of program that the regional center was able to offer. The second one is she's choosing what she wants to do with the funds. And it's been amazing, her choices and the support she has gotten to do the things that she is doing. There's no downside. It's just the administrative work, I would say, is more than I had anticipated because I am the person who is in charge of how that money is being spent. You can hire someone to do that, but I chose to do that, and there's a learning curve to that. But once you're there, it gets so much better, and it's a new program. And so with a new program, there's always going to be growing pains. And we're in the forefront. We are like the grassroots of this, or the self-determination where, we are the beginning of it, but we're helping to change things and make things work well. And when you're involved as a participant, you're making those changes that benefit everybody.
Thank you, Deborah. Thank you for that. Give her a hand. On the spot. All right, we're going to talk about a few terms to know, especially if you are newer to this system, some things that we can highlight for you. Person-centered planning. Whether we're talking traditional regional center services, self-determination, or you're just starting your journey, and really it's like, okay, what is the first thing I need to know about and look into in practice? It's person-centered planning. Again, we could spend the whole day just talking about person-centered planning. Don't have the time to do that. But the idea is this is not a one-time thing. This is a lifetime cycle of exercises and discussions and meetings and observations and thinking about yourself, if you're someone with an IDD, or your family member, the person that you're serving, if you're working with somebody, And by the way, this works for you. I did this when I was going to grad school for myself, some person-centered planning exercises. So it's good for everybody. But identifying strengths and challenges and preferences and needs and desires, short and long-term goals here, and mapping out not just what is important for a person to thrive and succeed, but what is important to them. And those things are different sometimes, and both need to be accommodated in any type of plan moving forward. Individualized family services plan, if we have anybody with the littles under 3 years old, that's the plan, right? The plan that is your contract with the regional center and with the state. If you yourself or have a loved one who's an adult, that's an IPP, formal written plan, legal agreement. If it's not in the IPP, it doesn't exist, folks. Doesn't matter what you talked about and what vision and services and mapping that you've done with you, your circle of support, with your regional center. If it's not in that IPP, it doesn't exist, and the regional center and the state doesn't have to do a darn thing about it. So in long and short of it there. All right, so what are some examples of services and supports, Ingrid?
So Sheraden and I thought it would be helpful to have the actual law language that you can use as a reference if regional centers were to deny your service or when you're not quite sure what the law says. And so we're not going to be reading every single word on these slides, but I just want to point out a couple things. So the services should be based on the needs and preferences of the individuals and their families, and shall include a range of services. And Sheraden talked about the importance of the IPP, which is that legal document. And regional centers are also, they need to consider the cost effectiveness of each option. And that's why with certain service requests, you may be asked to submit 3 bids. This slide talks about the services and supports and what they're supposed to be directed towards to. And I feel like this is where the law can be changed to be looking through a more neurodiverse lens. But currently the law says alleviation of a developmental disability towards the social, personal, physical, or economic habilitation or rehabilitation, and towards the achievement and maintenance of independent, productive, and normal life. And so as an example, at GGRC, the purchase of service guidelines that was approved by DDS says that the service request either needs to be directly related to a person's developmental disability that they're eligible under, or the absence of which will lead to worsening of that developmental disability. And as an example, thinking of dental services, because Dr. Wong will be speaking later, that may or may not be directly related to a person's developmental disability, but regional centers can fund that for people without dental insurance, because we can argue that the absence of good dental hygiene will definitely make that person's developmental disability worse.
And we know, speaking of language change, right? It's not a person's disability that needs any kind of alleviation. It's us changing the environment and the systems to better serve folks with diverse needs, not special, diverse needs, right? Because we all have diverse needs.
Yeah, thanks, Sheraden, for pointing that out. That's why I think what I was saying, I feel like the law language can be updated. And so the Lanterman Act I mentioned about entitlement services, and these are all the services and supports that's listed under the Lanterman Act. And we wanted to show the whole range of services that's available. So as you can see, it goes from diagnosis, evaluation, treatment, to therapeutic services, to mental health services, advocacy, community services, crisis intervention, social skills training, paid roommates and neighbors, respite, which is commonly known, specialized medical and dental care, training for parents. So for example, parents coming to this conference, the conference fee registrations can be funded by regional centers, and transportation. And so why do you not see people getting all these services that the Lanterman Act promises? Part of the reason is that the law also places additional restrictions on regional centers. So these are the law language regarding generic services. So using, for example, if the school system is supposed to pay for something, or Medi-Cal, or the health insurance, regional centers by law are required to explore those options. And the law also says to consider the family's responsibility for providing similar services for a child without disabilities. More about generic services. And so we talk about schools, there's the IHSS, there's California's Children's Services, there's the county mental health system. And so that's why you may hear terms like regional centers are the payer of last resort. Even though regional centers cannot technically fund services that you're eligible through other systems, they can while you're pursuing that coverage and before a denial is made by the other system. So we know that it's not uncommon for families to wait months or sometimes years for certain services through the health system, as for an example. Regional centers can gap fund until that other system takes over. And technically, the regional center can help you advocate for services from generic resources if it's in the IPP. But as you may have encountered in your experience, regional center social workers have huge caseload ratios, and oftentimes that's not what's happening in practice. And I think just a word about payer of last resort. So even though regional centers are supposed to be the payer of last resort, I don't think that it should be used generically to deny services, because there are exceptions to be considered. For example, even though regional centers don't fund educational services, regional centers can fund aids for after-school programs. Or if a person is hospitalized, regional centers can fund, for example, an aid to be in the hospital to support that person while they're in the hospital. Or for desensitization programs for procedures. So they can supplement additional services that are provided by other systems. And we were asked to specifically address about services that's available for different age groups. I think commonly people think about birth to 3, 3 to 21, and 21 and above. And I think I like to talk about certain myths that I've heard. So from birth to 3, we commonly think of early start services, so California's early intervention program, and which is true. And you may often hear the first myth is that Land Term Act begins at age 3, which is technically not true. The law does not say Land Term Act begins at age 3. I have determined eligibility for children less than age 3 for Land Term Act services. At San Diego Regional Center, infants with Down syndrome are granted eligibility for Land Term services during infancy after they graduate from the NICU or the newborn nursery. So oftentimes we may get requests for families for Land Term Act eligibility during the early start period because of, I think, 2 key services. One is respite, which early start programs don't provide. And then the other is institutional deeming for Medicaid waiver to get Medi-Cal as secondary insurance to help pay for things like co-pays or for home health care. And moving on to 3 to 21, oftentimes you may hear that the schools are the primary funders of services in that age group, which is technically usually true for educational services, but regional centers can do a lot. I think the second myth I commonly hear is that regional centers only provide respite and diapers, which is also, that's not what they only provide. As you can see from the previous slide about services, I'm just gonna go back to this page. When the law lists all these services, it doesn't say which one is for 0 to 3 or 3 to 21 or 21 and above. Some of that's common sense. For example, we wouldn't be doing vocational training for a 5-year-old child, for example. But the law doesn't say that only these services are specific for each age group. So I think the other thing that has changed a lot now that all 50 states have autism mandate legislation covering therapeutic services, which has expanded to other conditions as well, is that we also commonly see the health systems providing things like speech or OT and PT during school age years. But regional centers can also supplement those services. For example, when we consider AAC devices, augmentative and alternative communication devices, or even though oftentimes, if you ask for ABA directly from a regional center, they may say health system's supposed to provide that or the school's supposed to provide it. We can provide behavioral consultation services for things such as toilet training or elopement or other behavioral concerns.
And by the way, on the DDS website, and we have some reference links in the last few slides that you'll get, and I don't know if there's this particular one, but we take you to this section where you can see kind of a chart of the major service categories and a little description of who those are. The DDS put that together about 5 years ago, give or take. And it's helpful. But again, you're not going to find a menu because it's not about a menu. It's about the IPP process, right? And identifying what your individual's needs and desires are. And then from there, okay, what's going to make a difference for those? So it's got to be IPP based. It can't be selecting off of a menu of services. So how are we doing on time here? Because I know we started a little late. All righty. So let's fast forward a little bit through the IPP, okay? We were emphasizing this again and again. I would have to say probably when it comes to technical assistance cases that come to my office that are regional center related, I would say about 60 to 70% comes back to the IPP. Comes back to the IPP, we don't know what's on it, or it's not updated, or it's not accurate, or, oh, I didn't know I had to sign that, or, oh, I kind of vaguely remember that meeting, but like we just talked generally. So almost all issues can go back to that IPP is not working for you and working for your loved one. So always go back, and there's a lot of great documents and some resources that we're sharing, but making sure that you're on top of that. If you need to update that IPP multiple times a year because circumstances have changed or lifestyle has changed or new health conditions or behavioral needs have changed, then it should be updated. Absolutely. And then you can sign parts of it. You don't have to sign all of it. If you're working on coming to an agreement or resolving a dispute about a certain part of the IPP, you can sign off on the other parts to say, well, let's get these things going because we all agree on this. This part we're going to have to work a little bit more on. So you have that right as well. Let's see here. For depending on, an IPP has to be revised at least every 3 years, but it could be revised many more times. And there should be an IPP meeting once a year for most individuals in most situations. But again, you can call that IPP meeting at any time that there needs to be an update or more looked at, and person-centered planning exercises, discussions should take place before that. So you come in having a good understanding of your own or your loved one's needs at that point in time, their goals, and any changes that might need to happen. And then you have language rights for phone calls with your regional center, for meetings, especially for IPP meetings. The IPP document itself should be coming to you in your preferred language. So, and by the way, you see on most of these slides where we're talking about rights, we have welfare and institution code references for you, okay? Best practices working with the regional center. So it's a working relationship. Is it always gonna be perfect? Probably not, right? I mean, it's a working relationship. And Ingrid mentioned the impaction of these systems that are serving many more people than they were designed to. And that's the failure, right, of our system to fund and to grow and develop them to meet the community need, right? But knowing that, get to know your regional center and the DDS website and where you can reference things and bookmark things. Everything should have a paper trail. I mentioned earlier how if it's not on the IPP, it doesn't exist, but also even for other conversations, keep your records. The good record keeping is key. And then always take it back to the goals and the needs and the IPP, and know your timelines for action. And we're going to talk a little bit about those timelines for action.
So as with any other systems, it's important to know your rights and how you can advocate for yourself when you don't get the service that you request for. So Sheraden and I will go through the dispute resolution and other complaints processes. So as the name implies, dispute resolution is when you disagree with a resolution made by the regional center regarding your service request. And this is a notice that regional centers give you when they deny a service that you're requesting, or if they're planning to reduce it or discontinue a service that you've been receiving. The first thing to do is, if the regional center doesn't give you one already, is to request for a notice of action. And this is a notice that regional centers are supposed to give you when they deny a service. I find that oftentimes family may not get this because it's denied at the social worker level. So it's important to request for a notice of action whenever your service is denied because, one, y'all have the reason why the regional center denied this service. It will be in this NOA, which is a notice of action for short. And it will also outline your appeal rights. And second is that you will know that your service request was elevated to the level of a supervisor, not just at the social work level. And after receiving a notice of action, It doesn't mean that you have to go to appeal or the fair hearing process, but you have the rights to. So you have 60 days to appeal. This process is asking for a decision to be reviewed when you believe the decision was incorrect. So the way to do this is to fill out a fair hearing request form in writing or online, and we provided the link here. Another important term to point out on this slide is aid paid pending. It's the right for you to continue your existing service unchanged unless the appeal decision was ruled in the favor of the regional centers. But I think the important thing to note is the days. So instead of 60 days after receiving an NOA for you to file an appeal, to get your services continued unchanged, you have 30 days.
It used to be only 10, but it last year, some of the components changed, and so now people have 30. It used to be only 10 days.
And while you appeal for a decision and before waiting for the fair hearing process, there are two optional steps that you can go through. One is an informal meeting. This is a meeting with decision makers from the regional center to discuss the services or eligibility that you need and would like to dispute. It's a quicker process, so the informal meeting must take place within 10 days of the receipt of your appeal paperwork. And the regional center has then 5 working or business days to send you a letter with their decision. The other step, which is or, you don't have to go through this step either, it's called mediation. And it's a meeting with you, a regional center representative, and a mediator, who is usually a neutral third party trained to serve as a mediator. And this is to be held within 30 days of your appeal paperwork. And a written resolution goes into effect 10 days after both parties agree. By going through an informal meeting or the mediation process, does that mean you give up your rights to an appeal? You can do that while you're waiting for the fair hearing to take place. The fair hearing is going in front of an administrative law judge. And this is the procedure to appeal the decision of a regional center, which should be held within 50 days. So as you can see, it can be a longer process.
And I want to emphasize how many issues get resolved at that informal meeting level. So please do consider that, because it's quick. And a lot of times families come back or individuals come back and say, we came to an agreement. That was fast. I didn't have to go through fair hearing. And it's like, awesome. So I always encourage people to at least consider that, because that can get things done so quickly and effectively and efficiently, and also, build that leadership and power for the individual in their circle of support.
And all these terms and timelines are pretty confusing, so we developed this flow chart to hopefully simplify the process somewhat. So the ones in blue are generally the process, and the ones in like yellow and green, which are in different colors, are the optional steps. You don't have to go through this. You also have the right to stop at any time, so you don't have to feel like you have to go through every single of these steps. We also put the timelines up there, but I think the important thing is when you do get your notice of action paperwork for the appeal process, just double check the paperwork for any date changes. For example, the timeline for notice of action to appeal used to be 30 days. It was extended to 60 days. Or to resolution, it used to be 80 days, and now it's up to 90 days. So it's good to double check your paperwork.
And this is such an oversimplification, so don't just rely on one simple flow chart. There are brochures that we can make sure you get. They're available on the DDS website that go through each step in more detail. But this is such a helpful visual for big picture thinking. Just don't rely on this. And also, there's your code. Your code is your friend.
And just some more points about fair hearing, which can be, I think, quite scary if we haven't gone through that before. So it's a hearing before an administrative law judge, which in my experience are usually attorneys who have retired, or they're doing this in addition to their own practice. And we had talked about how it takes place within 50 days. You have the right to interpreters. And if you do decide to have an attorney represent you in front of the law judge, regional centers will usually have their own attorney that they contract with to represent them as well. And even after a decision is made at this level, all parties can ask for a reconsideration within 15 days of the decision. And you can have, you can appeal the decision beyond that. You can appeal the decision within 180 days of that decision, and the appeal is to go to Superior Court.
So we want to make sure to mention about a few other dispute resolution or, filings that are involving your rights. First, we want to bring up is a 4731. I'm just curious, you don't have to raise your hand, but who has filed a 4731? I sure have. Yeah. Guys, definitely, this is important. And I want to, just to add context here, dispute resolution sounds like it's contentious. No, this is the way the system was designed so we can make sure the system is working as intended. So don't think of this as fighting. Don't think of this as, contentious back and forth. This is a quality assurance process. Both the fair hearing process that you just heard from Ingrid, as well as some of the other rights filings that I'm talking about. This is the way that we protect and enhance and support the civil rights that we all worked really hard to get. So I want you to embrace these things. This is not, these aren't bad things. These are helpful things, and they only work when we use them and use them collectively, not just for yourself or for your loved one, but for the next person, especially the next person that maybe doesn't have the education, the knowledge, or the confidence to be able to use these systems the way that they're intended. But if 4731 is about making a complaint if your rights have been violated, or if you believe your rights have been violated, and that could be with regional center, a developmental center for the, under 200 people that are still in more restrictive settings, or service provider as well. And it's about saying, hey, I think my rights were violated. I'd like it to be looked into, and I want to make sure this doesn't happen to other people. That could be during eligibility process or when you're in services or by a service provider. And then there's a simple form. It's available in different languages. And then there's a timeline of when they have to get back to you, when the executive director of the regional center or DDS director has to get back to you about that. And then there's appeal processes as well.
Give us an example of just we can make it up what that might be.
Yeah, so like if the other timelines, let's say the timelines that Ingrid was talking about, if those aren't respected and you're waiting and waiting and waiting and waiting and you or your loved one is going without services or you're asking for your IPP meeting and it's never happening and they're never booking a time with you. Yeah, so if your rights in terms of access to having these meetings or the timelines that are clearly stated in Welfare and Institution Code, did I do that?
Oh, no, I did that.
Yeah, so that's a simple example, but if you want more examples, we can talk offline. You can reach out to our office and we can go through more examples there. But super important that you know about that, and that's separate from fair hearing, okay? Sometimes people might be in a situation where they're in the process of fair hearing and they file a 4731 because in the process they realize that their rights were violated or they suspect they were violated, okay? A little bit more just about the process there, okay, in terms of timelines. Also, whistleblower complaints about improper regional center or vendor activity, particularly from in-house, but can also be provided by community members as well. And then language complaints. I think I mentioned earlier, if your primary language is not English, is something else, first make sure that that's in the case file, make sure that that's documented. And then phone calls, you should either have a service coordinator that speaks your language or have an interpreter that they pay for, right? For those phone calls, for those IPP meetings, and for other meetings maybe related to fair hearing or something else that you're going through, okay? And how do we know that this works? Well, again, we have to use our system. So if you're not satisfied with the interpretation services, then there's a form, again, in many, many languages. You can reach out to our office. We can talk you through it, show you the links, kind of talk through what information should be there. But that's really important, okay, that people are able to get these important decisions and conversations and documents in their preferred language. And preferred, right? So maybe you speak English, but you're more comfortable in Cantonese. So nobody should tell you, oh, but your English is fine, so let's just have this meeting. No, I prefer to have it in my preferred language. You have a right for that. Advocacy. We could spend all day talking about advocacy. Well, you are spending most of the day talking about advocacy in different forms and fashion. But we just wanted to highlight with our last few minutes. Is this mine or yours? Yeah, good. There are so many ways that you can make a difference in the regional center system to promote better, more effective ways of the system working for all people. And it's getting involved. And even if you don't have a lot of time, you can pick one or two of these things. The Regional Center Board of Directors meetings, going to those meetings. Most of them take place hybrid or over Zoom, and making public comment, giving, consideration and talking about what's working or not working. Every regional center across the state has to have at least one public meeting about purchase of service, about how they create policies around how they cut authorizations for services. Go to that, talk about it. Sometimes I'm the only person from the community at these purchase of service meetings. It should be primarily community members at these meetings. Same thing with performance meetings. These also have to have public meetings where the regional center's talking about their performance plan and their goals and what they're aiming to do and how they're doing, and show some qualitative and quantitative data. There's other info sessions and public meetings and hearings. Like right now, if you're passionate about systems change, many of you've heard that California Health and Human Services is in the process of building a master plan for developmental services. Both the master plan committee and its five working groups, those are all public meetings. I was just on one yesterday. There were dozens, if not hundreds, of community members giving feedback and public comment. Super important to get involved. And then also state council meetings or regional advisory committee meetings. We love to have the public come and talk about what's working and what's not working.
Sheraden, how do people find out when these meetings are and where they're taking place?
Yeah, on the regional center's website, they're required to post those. And if it's hard to navigate, give me an email or a phone call and we can help you find the specific page. For most of the regional center public meetings, you can usually find that under a header of like transparency and governance. Usually that's what they label it, transparency, governance, or governance and transparency, or management transparency. Yeah. Other kinds of advocacy. Your assembly members, your state senators, your congressional leaders know about the regional center system. But if they don't hear from you about what's working and what's not working, then they can't be your allies and advocates to make a change. And we've talked about some of the changes in law over the last handful of years and some of the other ones that are going to roll out in the next couple of years. That is because community members like you all are working with your legislative offices to push things forward. So don't underestimate that. Mostly we have these here that we mostly refer to, but there's so many more. So if you reach out to us, we can definitely give you other links and resources that are specific to your regional center or specific to whatever system that you're looking at here. But these are some ones that we thought would be most helpful for you. And then these are all the regional offices of the State Council, in case you're not from here. But if you reach out to me, I don't care where you're from, we'll get you connected to the right people, of course. And then we want to hear from you. Absolutely. Thank you all for bearing with us. First session of the day. I know we started a little late.
That's
Perfect.
I wanted to ask you, you said that unless it's in the IPP, it kind of doesn't count. What is the relationship between the PCP, which has a lot of information, and then the IPP? Should we be making sure it's like everything from the PCP gets translated in that?
Yeah. Your person-centered planning activities, or if you do a formal person-centered plan, super terrific. That's like, keep that with you, but the important parts need to be transferred over to the IPP. That person-centered plan is not your legal agreement, but it is the foundation. It's like the cement, it's the pillars, it's, the rebar. That is what you need for sure. Yeah, but the IPP, that's the document that's like, okay, it's real or it's not real. I saw another hand over here.
Hi. Thank you for your wonderful presentation. Learned so much. First of all, I have two questions. The first one is, you said the regional center is a nonprofit, but who funds it?
Department of Developmental Services.
So it is a state-funded nonprofit organization.
Got it. State-funded, nonprofit. They exclusively work with the Department of Developmental Services. They're the ones that are developing contracts with community organizations for the service providers. Yeah.
Okay, got it. And then the other one, when you had the lady come and speak about managing the funds for their child.
Self-determination.
The self-determination piece, yes. And how, that, like, when I hear funds, like, is there like an allotment of funds for a particular person, or,
It depends on the IPP. Yeah. So that looks different for every person based on their needs and their goals and the challenges that they need support with. Yeah.
And so like,
So that dollar amount looks different for every person, either in traditional services and in self-determination.
okay.
I think what regional centers do is they look at your past year's budget. And so then that's how they determine the funds for the self-determination. But it also depends on what's in your IPP. So if your needs or your services change, they can consider that. So that funding amount is not set. And so that's why the IPP is so important.
And that's just the starting place. There's a whole worksheet on that. Don't tolerate just like the transfer of what we did last year to this year, because it's about the IPP. But you kind of start with, well, were you here last year? But maybe not. Maybe you just joined the regional center, so you don't have any history of a budget. You're still going through that process, and there's actually a cool worksheet that gives you an overview of that process.
Okay, thank you.
When filing Form 4731, could you use that form for, like, let's say your budget is $100,000 and you are not satisfied with that budget, is that the form that you would fill out?
No, that would be a fair hearing. If you don't agree with the amount or the type of services that you're getting and you can't come to an agreement working with your regional center, then you're appealing that decision and starting fair hearing, which might involve an informal meeting or a mediation or the actual full fair hearing process with an administrative law judge. The 4731 is about rights violations, either rights violations from, the regional center or the service providers that you're working with. Good question. Great questions.
I have a question about this vendorization, either it is in traditional model or the SDP. For example, my daughter wants to swim, but the swim school she goes to, lots of chlorine or whatever, she developed eczema. Now, it takes a really long time to, get over that itching or whatever the facial changes. Say I have a swimming pool at home. I can hire a trained student, a swim instructor, or anybody that is qualified, of course, to come and teach my daughter at my swimming pool. It's a hypothesis, right? So I see that the POS allows me only to the vendorized swim school, or I have to reimburse. And over a period, how these funds can accumulate to really large sum. And the expectation on the family is to fund it ahead of time. So not all families can afford to do that. So why not give families some agency on the providers that they actually want for their family member?
Check out self-determination. Yeah, absolutely.
Okay, it was my understanding that even self-determination, what if it is only to X vendor? So everybody, how about that individual, say college student who is a swim instructor, how do they become a vendor?
You don't have to only hire vendors with SDP. You could hire vendored services or non-vendored services.
Okay.
Yeah.
Okay, that's good to know. Thank you.
What happens when your regional center doesn't respond to your questions? And if they don't also have a program or they don't have the services that you need?
And so I think, it's not uncommon for me to hear that they don't hear back from their regional social workers. I think this is where you can ask for the supervisor, or you can also file a complaint because your rights are not being respected when you don't hear back from your staff. And so, but if there's a service that you request where for example, they may not have the provider. I think this is where, for example, they're not really denying the service, but then they say that you may have to wait like a year to get the service. Would that be a 4731?
That could be filing a fair hearing because they're effectively saying no, right?
But then you have to make sure you get the NOA.
Yeah. But even if you don't get an NOA, you can still move forward, right? If you're saying, hey, I know what my rights are, I'm supposed to be hearing back, give me an NOA because you're effectively denying services and you still don't get it, you can still move forward. You don't have to have that in your hand before you start with appeals. But and Ingrid brings up a good point. You should know 100%, even if things are smooth sailing, you should know your service coordinator, your social worker supervisor, and also know who the unit manager is. Because with caseloads, with turnover, with all of these things, you should be ready in terms of communication to go to that next step, that next level. in addition to knowing your rights for appeal, you know, because sometimes it's as simple as getting the supervisor involved and all of a sudden things are moving along great.
I wanted to thank you for that because when I was applying for Medi-Cal for my son, like his caseworker left, and so he was without a caseworker for a while, and so I was calling the caseworker for the day, like multiple days in a row, until I got somebody who was like, oh, I'll get my supervisor. But it was like, I didn't know that that's what the magic words that I needed to say. Can I talk to your supervisor? It was just whoever the caseworker of the day was getting back to me and whether or not they knew what to do.
Yeah, exactly. I think that's a very good point. And you can also ask to speak to any of the managers or the directors. So for example, many requests may not come to me, but if it came to me, then I wish I had known earlier because it's something, there was a case that came to me a year later, and I wish I could have helped out a year ago.
Okay, thank you very
Thanks,
much.
everybody.
Next round of applause. Thank you.